Everything they've done has been fantastic. So much nicer. It makes people feel better when they come into the surgery. It makes us feel better. It's bright, it's fresh, and it's just lovely to see it all.
I think the patients, everyone that's been in, have enjoyed coming into the practice. It's a nicer environment to sit and wait to see the doctor.
It's far superior. There's more space. It's a lot better in that respect. Yes, they've done a good job.
It's a modern building to take care of modern times.
And the initial challenge with the whole project was to make sure that we come up with the right solution for the community.
The main issue with the building was it wasn't actually big enough.
The previous facility was very cramped and people were getting quite frustrated coming to appointments. It was built probably 30 years ago.
The rooms were smaller, they were darker, less airy, poor ventilation.
I don't think we realised how run down it was until they started obviously doing certain areas, and then you realised.
I think this surgery opened in '77. We always use it when he's got multiple sclerosis, so we come quite often. And the change now is better, especially for a wheelchair. It's a lot more open plan in there, easy access. Before it was like rows of chairs regimented.
When I first came in, it didn't used to be as easy as this. The waiting area now is very good. You work cramped together, and for someone in a wheelchair, that is more important.
We use the auto check-in, it's pretty quick and efficient. Before it was on the other side, where you had to go through all the waiting patients to get to it. Now it's in the entrance where it should be, and it's easy to use. And that helps cut down on queuing.
There's toilet facilities are easily accessible, so that generally it's benefit the community and the area as a whole.
The location of the existing health centre is exactly the right location because this is in the heart of the community and this is where it needs to be.
We couldn't shut the building, every service had to still run. The key bit behind it was the communication really, getting everybody involved, practice managers, doctors.
Patients involved in the design, painter and decorator involved in the design, and everybody took a responsibility for a successful outcome.
So if you're involved, then you own it, don't you?
Bearing in mind the confines of the area and the fact that the surgery was still operating while they were building this surgery, it went extremely well. There was no conflict. You could still get to the original surgery while they were building this one. It seemed to work very well.
I think they ran it pretty well in conjunction with the builders. It was good. We didn't feel it affected us in any way, shape or form.
With this sort of atmosphere, there's now less resistance to come into the doctor's surgery because it's a pleasant experience to come.
And we have found it pretty easy and quick to get appointments as well. It takes the worry off you, and you can't really do much better than that, can you?
The health centre is almost like a community hub. We try and involve all aspects of the community.
The tea bar, that's reopened again now, so we found that you're getting a lot more of the elderly coming back in, patients that we maybe haven't seen for a few months. They're now sort of coming back in to have that little bit of a cup of tea and a catch-up with their friends.
We have special police officers, the PCSOs, they come in on a regular basis.
It's an indication to the community that things are happening and they're not being forgotten, and I think it's appreciated.
We're much happier, we're much more content, it's a better working environment.
Well, certainly I'm happy. I think my colleagues are happy as well. You know, the environment we work now is for bigger room, modern, and with all the facility we're supposed to have.
We're all much closer together, which makes it much easier for working together.
We feel more of a team now. We used to work from the annex outside where the staff had to be separated, GPs was working out there. We've now been all brought together, we're all on the same level. Everybody's feeling much better, positive attitude, and I think that comes across to the patients.
I think it has made it much better for our patients. It's just brought us into the 21st century.